Introduction to viral conjunctivitis. Viral conjunctivitis, commonly referred to as pink or red eye, is a highly contagious infection of the conjunctiva, the thin clear tissue that covers the white part of the eye and lines the inner surface of the eyelids. This condition is primarily caused by various viruses, including adenoviruses, enteroviruses, and herpes simplex virus. Viral conjunctivitis spreads easily from person to person through direct contact or exposure to contaminated surfaces. It affects millions of individuals worldwide each year, with symptoms ranging from redness and itching to excessive tearing and discharge. While viral conjunctivitis typically resolves on its own within a few weeks, understanding its causes, symptoms, treatment options, and preventive measures is crucial in managing the condition effectively and preventing its transmission to others. What is viral conjunctivitis? The dreaded conjunctivitis, or as it's more commonly known, pink eye. It's that annoying eye infection that turns your pupils into rosy orbs of discomfort. But what exactly is viral conjunctivitis? Well, it's an infection of the conjunctiva, the thin, clear tissue that covers the white part of your eye and the inside of your eyelids. History and prevalence of viral conjunctivitis. Viral conjunctivitis has been around for ages, probably as long as humans have been rubbing their eyes. But it wasn't until the invention of the microscope that we truly understood what was causing all the eye-rubbing mayhem. Nowadays, viral conjunctivitis is pretty common, with millions of cases reported worldwide each year. It's like the common cold of the eye world, spreading like wildfire among kids, adults, and even the occasional eye-rubbing celebrity. Causes and transmission of viral conjunctivitis. Common viruses that cause conjunctivitis. So, who are the culprits behind this eye-catching infection? Well, several viruses can cause viral conjunctivitis, including adenovirus, herpes simplex virus, and even the same viruses that give you the sniffles. They're like tiny eye hijackers that invade your peepers and throw a pink party. Modes of transmission. Now, let's talk about how these sneaky little viruses make their way into your eyeballs. You see, it's not just by simply staring into the eyes of an infected person, although, let's be honest, that might do it too. No, viral conjunctivitis can be transmitted through direct contact with infected eye secretions or objects that have been contaminated. So, sharing towels, pillowcases, or even touching an infected surface and then rubbing your eyes like you're auditioning for a sequel of The Karate Kid can all lead to pink eye. Symptoms and diagnosis of viral conjunctivitis. Alright, now that we know how those pesky viruses get in, let's talk about the telltale signs of viral conjunctivitis. Your eyes will also feel itchy and kind of like there's something in them, but no matter how much you rub, you just can't seem to get rid of the annoyance. Differential diagnosis of conjunctivitis. Now, I know you're probably thinking, how do I know if it's viral conjunctivitis or some other eye-related drama? Well, your friendly eye doctor will help you figure that out. They might ask you a bunch of questions, examine your eyes, and possibly even take a swab to determine the cause of your eye woes. It's like being a detective, but instead of solving crimes, they're solving eye mysteries. Treatment options for viral conjunctivitis. Self-care and home remedies. When it comes to viral conjunctivitis, the good news is that it usually clears up on its own within a couple of weeks. But in the meantime, you might want to try some self-care and home remedies to ease the discomfort. Get yourself some artificial tears or soothing eye drops to relieve the itching and redness. Oh, and don't forget to give your eyes a break from contact lenses and skip the mascara for a while. Medications for viral conjunctivitis. Now, I hate to be the bearer of bad news, but when it comes to viral conjunctivitis, there's no magic pill to make it disappear overnight. Antibiotics won't do the trick because they only work against bacteria, not viruses. So, unless you have a secret stash of antiviral eye drops hidden somewhere, you'll just have to ride it out and let your body's immune system do its thing. But hey, at least it's a great excuse to rock those trendy sunglasses and pretend you're a celebrity incognito. So, there you have it, the lowdown on viral conjunctivitis. So take care of those eyes, avoid the eye-rubbing temptation, and before you know it, you'll be back to batting those lashes with pride. Preventive measures and hygiene practices for viral conjunctivitis. Best practices for preventing viral conjunctivitis. Preventing viral conjunctivitis is all about keeping those germs at bay. Here are some tried and tested tips to help you avoid those itchy, red eyes. Wash your hands like a boss. Regular hand washing is your best defense against a viral invasion. Scrub those hands with soap and water for at least 40 seconds, especially after touching surfaces that could be germ-infested. Don't touch that face, we understand, sometimes it feels like your hands have a magnetic attraction to your eyes. Touching your face, especially your eyes, can transfer those pesky viruses from your hands to your delicate peepers. Sharing is not caring. When it comes to personal items like towels, pillows, and eye makeup, keep them to yourself. Sharing might be a virtue, but sharing eye germs is definitely not. Hygiene measures to reduce transmission. When you're dealing with viral conjunctivitis, it's crucial to keep your surroundings clean. There are some hygiene measures you can take to minimize the risk of transmission. Disinfect, baby, disinfect. Wipe down frequently touched surfaces like doorknobs, light switches, and countertops with disinfectant wipes or sprays. Those little buggers can lurk on surfaces for hours, just waiting for their chance to strike. Be a tissue ninja. If you need to sneeze or cough, don't do it into your hands. Instead, use a tissue or your elbow to cover your mouth and nose. This way, you can prevent those virus particles from finding their way to your eyes or spreading to others. Bye-bye, contaminated items. If you suspect that an item has come into contact with viral secretions, say your trusty eye drops or your favorite sunglasses, it's best to bid them farewell for a while. Toss them or keep them isolated until the contagious period has passed. Complications and long-term effects of viral conjunctivitis. Potential complications of viral conjunctivitis. While viral conjunctivitis usually resolves on its own, there are a few potential complications that can make it a bit more than just a minor eye irritant. Keep an eye out for these complications. Corneal infection. In rare cases, viral conjunctivitis can lead to a corneal infection, which can cause vision problems if left untreated. If you experience intense eye pain, increased redness, or vision changes, it's time to call in the professionals. Bacterial superinfection. Sometimes, bacteria can take advantage of the weakened state of your eyes during viral conjunctivitis and cause a secondary infection. Thanks for watching.